It's Diabetes Awareness Month, and this disease isn't rare. Over 130 million Americans live with diabetes or prediabetes right now. And if nothing changes, 1 in 3 adults will be diabetic within the next decade. It's because this disease changed my life that no matter how much I've learned as a quadruple board certified endocrinologist, it will never be as powerful as the collective. So I pulled together the top endocrinologists in the country into a 2-part series and asked them one question. What's the number one thing every diabetic needs to know right now based on science, not trends?
This is my number one tip if you have diabetes, either type 1 or type 2. Remember that muscle consumes 80% of the glucose in blood for energy. 80% of the glucose consumption is done by muscle. So a walk after every meal is really going to help to regulate your glucose. I know it sounds silly, but every time the muscle contracts, it sucks in glucose for energy. So build your muscle. Strength training and even movement after a meal is going to help you a lot.
Something I wish all patients with diabetes knew is that GLP-1 agents are the most powerful tool that we have had to treat diabetes, with the exception of insulin. And they are an amazing tool which helps many people get off of insulin, get their A1C controlled, lose weight while decreasing inflammation, sometimes able to get off of blood pressure medications, other medications, potentially cholesterol, triglyceride medications, and have a significantly lower risk of heart attack, stroke, liver disease, kidney disease, obstructive sleep apnea, osteoarthritis. The list goes on and on.
One thing I wish all of my patients living with diabetes knew is that diabetes is not your fault. You did not do this to yourself. There are plenty of factors that go into diabetes, like genetics, like environment, like socioeconomics, like culture, not just lifestyle. Lifestyle does play a part, and there are reasons that you have the lifestyle you do. This is not your fault, and you deserve compassionate, expert-led care that actually helps you feel better and helps you get better, helps you get healthier. I hope that everyone listens to this. Stop blaming people living with diabetes, and especially people living with diabetes, I hope you stop blaming yourself.
The best piece of advice I can give those living with diabetes is never underestimate the power of lifestyle and how it can improve your blood sugar. I have seen countless patients coming to me taking many different diabetes medications, come off their medications or some of their medications slowly, solely with lifestyle changes, whether that's focusing in on dietary changes or improving exercise, improving physical fitness, improving lean body mass, working on stress reduction, drinking more water, etc. These are all important lifestyle tools that can help you get your blood sugar under control. So don't underestimate the value of lifestyle and make sure that is part of your treatment plan.